Despite Health Law 2017 defining emergency treatment as requisite in healthcare provision to prevent death or worsening of a medical situation, a report of emergency care services in Kenya still paints a worrying picture. Challenges ranging from substandard, ill-equipped ambulances to wanting emergency units at the referral hospitals are partly to blame for preventable deaths.
There are many people in Kenya die due to lack of emergency care, and if you're looking for a number, then just look at the top 10 conditions that cause death and disability in this country. That will give you an idea of what actually number of patients would die due to lack of emergency care.
To reverse the trend, Emergency Medicine Kenya Foundation recommends the implementation of effective, prioritized, timely emergency care to address 54% of deaths and 36% of disability in low and middle income persons in the country.
But because of development, and as a society we've developed and are now having what we'd call first world medical problems. Your heart attacks, your strokes, road traffic injuries. I mean, for example, in Kenya right now, and globally actually, more people die from injury and road traffic accidents than HIV, TB, and malaria combined.
One of the programs that they've rolled up and which we are currently doing is the Health Insurance Subsidy Program. Through the Health Insurance Subsidy Program, the poor of the poor and people who are vulnerable can register to be members of NHIF. And through that, they can access emergency services.
Dr. Jeremiah Gitau from the foundation is appealing for the fully adoption of Emergency Medical Care Policy 2018-2030, set to be launched later in the month, which he says will offer a blueprint on emergency healthcare provision in line with Jubilee's Big Four agenda. Gitau terms emergency treatment as a golden hour meant to provide initial resuscitation, stabilization, and treatment to acutely ill and injured patients and delivery of those patients to the best available definitive care. NHIF officials who attended the forum say the institution has begun providing insurance cover to include emergency care in its package. Currently, Kenya has an estimated 200 emergency care nurses, about 1,000 emergency medical technicians, and less than 15 emergency care doctors, many of whom are still undergoing training. Linus Moshigadi for Channel 1 News.